If you're someone dealing with pudendal neuralgia, there are certain things that may be happening in your day-to-day routine that could actually be exacerbating your symptoms, and you may not know it because it may not hurt at the time, it may show up a few hours later, or even a day or two later. In today's video, we're going to discuss these activities and things that you can do at home to provide a happy environment for your nerves so you can continue to get better. One of the biggest contributing factors to pudendal neuralgia symptoms are static postures. So what we define as static posture is if somebody's staying in the same position for longer than 15 minutes. We know that a lot of people with pudendal neuralgia get exacerbated symptoms with sitting. However, you can also be compromising yourself unintentionally when you stand in the same exact position for just a little bit too long. Ways to get around this would be to stand on something such as a piece of gardening foam. That's going to provide a slightly unstable surface, so you're shifting and moving moment to moment, avoiding standing in the same position, for example, at your standing desk for a little bit too long. You can also vary your sitting positions between a chair, between a certain type of cushion, between a physiotherapy ball. All of these variations will use different muscles, which will allow other muscles to take a break as soon as you change into the next position. Keep in mind the general rule of thumb is roughly 15 minutes. If you're stuck in your car for 20 to 30 minutes, you can also shift from side to side. You can rotate the position of your pelvis forward and backwards just to provide some variance to which would otherwise be a static and possibly problematic posture. When people wear even the slightest heel, this actually dramatically changes the position of our pelvis. It tips our pelvis into an anterior position, which lengthens a pudendal nerve and increases your pelvic floor tone. Both the lengthening of the pudendal nerve and the increase in pelvic floor tone can exacerbate the symptoms of pudendal neuralgia. We recommend wearing supportive sneakers all the time. Bare feet can also compromise the position of the pelvis in a similar way that heels can, and therefore supportive sneakers are really the best choice. In our bodies, everything is connected. Therefore, our ankle, knee, and hip positions can also affect the pelvic floor and symptoms of pudendal neuralgia. People with pudendal neuralgia notice that they have trouble walking up hills. This happens for two different reasons. Number one, there's increasing amounts of hip flexion as you advance a leg up a hill, which can tension the pudendal nerve. If your nerve can't slide, glide, and move properly, this extra tension can provoke a symptom. Also, when we are walking uphill, we have an increase in our pelvic floor muscle tone, which can compress the nerve and cause a little bit of symptom in that manner as well. A tip to get around this, because sometimes we can't avoid the hills, are to actually turn around and walk backwards. This is going to shorten the pudendal nerve as well as activate the posterior muscles, which actually allow your pelvic floor muscles to relax. Many people with pudendal neuralgia have noticed that core exercises increase their symptoms. It's helpful to understand why. When we do activities that raise our intra-abdominal pressure or activate our core, our pelvic floor muscles reflexively contract to support our bodies. If somebody has a pudendal nerve that's irritated, this contraction of the pelvic floor is going to further compress the nerve and cause a little bit of irritation that may show up in a delayed response. Therefore, we recommend working with your physical therapist to discover what time and place is actually appropriate for you to reintroduce these types of activities, and that typically is after the nerve is less reactive to touch. Easily, this is identified in a physical therapy session. Lifting heavy objects will result in pelvic floor contractions to help stabilize our bodies, which in turn can also exacerbate symptoms of pudendal neuralgia. We recommend finding ways to avoid lifting heavy objects. However, if you can't, we suggest doing diaphragmatic breathing and pelvic floor drops after lifting the heavy object, assuming that that did make your pelvic floor muscles tighter for the moment. Doing diaphragmatic breathing or pelvic floor drops can help the muscles return to normal tone if you can avoid lifting the heavy object. Pudendal neuralgia is a mechanical condition in which the nerve needs to be able to slide, glide, and move. In cases of symptoms, the nerve can't do that for some reason, and it can happen at multiple points along its course through the pelvis. One of the key muscles that compresses the pudendal nerve is called the obturator internus. This is an external rotator of the hip. It tends to get tight, and if that muscle's tight, it's going to impair our ability to either bend forward or raise our knees up to our hips. People will often notice that this does immediately cause maybe a shooting, stabbing pain in the territory of the nerve. Once we lengthen that muscle and get it to stop compressing the nerve, people can bend forward, they can bend over, and they can bring their knees up to their chest without a problem. But in order to do that, we need to restore the normal mechanics. If you notice that you're having trouble bending over or squatting down, there's a few little tips and strategies that you can do to make it a little more comfortable. When you have both feet planted on the ground, it's going to be more provocative for your pelvis and for the pudendal nerve. We suggest trying to slightly separate your legs or bend over using just one leg at a time. You can use assistive devices such as a grabber, or your physical therapist can show you techniques specific to you to help avoid provoking your nerve. One thing people with pudendal neuralgia may not think about is their fluid intake. A symptom of pudendal neuralgia can include urinary urgency and frequency, which results in our desire to go to the bathroom when our bladders are not actually full. This is problematic for many reasons, but one of which is because it starts to retrain our body to send signals that we need to urinate at less than normal volumes. By adequately drinking 64 ounces of water a day, we will have a full bladder when we go to use the bathroom. This will help keep our normal reflexes in check, as well as elicit a proper pelvic floor relaxation that cannot occur at lower bladder volumes. Speaking of our bowel and bladder habits, a squatty potty is a very effective tool for people with pudendal neuralgia. The squatty potty helps improve our pelvic floor alignment that allows any type of voiding behavior to be a little bit easier, and we do recommend that for patients with pudendal neuralgia as well. Something that isn't talked about enough is how much emotional stress and rising cortisol levels actually can affect the pudendal nerve. It is the only nerve in the body that has sympathetic, sensory, and motor fibers, which means that this nerve is going to be more sensitive to emotional stress, but also provides an opportunity to help calm the irritation by strategies such as diaphragmatic breathing and meditation. We understand that most people cannot meditate at the times they may be feeling emotional stress, but actually taking a pause and doing 5 to 6 deep diaphragmatic breaths is known to help lower cortisol levels and thereby help restore a calmer environment for your nerve to function normally. Here at PHRC, pudendal neuralgia is one of our top specialties. If you feel like you are struggling with these symptoms and would like some individualized attention, please give us a call. We're available via digital health and in any one of our 9 clinics for inpatient appointments. We also have out-of-town programs for people who are struggling, who can come to see us for a week or 2 at a time.